फिर हम स्टार्ट करते हैं. This course is all about MRCOG 1. First of all, I will introduce myself. I am Dr. Sana Hafiz. I did my MBBS from Qaeda Medical College, Bahawalpur in 2008. And I have done FCPS in Obstetrics and Gynecology in 2016. I completed my membership exam from Royal College of Obstetricians and Gynecologists, United Kingdom in 2022. I also have certificate in health professions education, and I'm working as assistant professor of obstetrics and gynecology at Shahida Islam Medical and Dental College. So, our in our session, we will discuss about what is MRCOG exam and what are the benefits of pursuing MRCOG, and should I do MRCOG along with FCPS? Why it's easier in Pakistan to do MRCOG now? I have tried to include all the questions that you people put in the Google Forms. So I will address those questions as well. And what is eligibility criteria for MRCOG 1 exam? How will apply for that? And what do I need to study? From where and how to start? And then I will give you a brief overview of different courses which are offered by MRCOG Hub. After that, we will have a brief overview of a session, how we will conduct our sessions in the course. We will discuss abdominal wall muscles, and then there will be a quiz regarding those muscles. I have chosen a topic which is commonly asked in the exam. Usually, 4 to 5 questions come from this single topic. So, I have decided to choose this topic, and this topic is a little bit tricky as well. So, MRCOG exam is a membership exam, as the name shows, of Royal College of Obstetricians and Gynecologists. It is internationally recognized, and it's a gold standard qualification in obstetrics and gynecology. 3 parts of exam are there: 1, 2, and 3. What are the benefits of doing MRCOG if one is planning to go to United Kingdom? Then there is no need to do PLAB for GMC registration. GMC registration can be done on the basis of MRCOG and OET or IELTS exam. And it's recognized in many other countries like Pakistan, India, Saudi Arabia, UAE, and many other Gulf countries. And there are no extra requirements other than working experience in Ops Gynae department in Pakistan. So you can do MRCOG without doing any additional training for MRCOG if you have done FCPS, or even if you're doing any other residential job in Ops and Gynae department other than FCPS residency, you can apply for that exam. So there's no experience required for MRCOG 1 and MRCOG 2. For MRCOG 1 and MRCOG 2, it's not essential that you're working in the Gynae department. However, if you're working, it's a benefit for you because you are in touch with the subject. And for FCPS, for MRCOG Part 2, 4 years experience is required. So in this experience, training of FCPS can be counted, or if you're doing MS in OBS and Gynae, it will be counted. Or even if you're working as a medical officer in OBS and Gynae department and your job is residential, it is counted as a training period. And now, why it's easier to do MRCOG in Pakistan? You know that 1 and 2 are already conducted in Pakistan. And from this year, from May 2025, third part has also been started due to some issues in May 2025. The in India and Pakistan situation that escalated in May 2025. This exam was postponed. However, it is again planned in August 2025, and in future, exams will be conducted in Lahore again. So there's no need to apply for visa, and no traveling to UK or other additional expenses are there. You have to pay only the fees for the exam. And you know that coaching is already available in Pakistan easily now. So, what is MRCOG 1 exam? Like any other exam, like FCPS Part 1 exam, it covers the fundamental and applied knowledge for clinical practice of OBS and Gynae. It resembles FCPS Part 1 in some aspects. It's computer based, 2 papers, each having 100 single best answers. And both papers are conducted in the same day with a break in between. However, you can in MRCOG1 exam, it's more clinical oriented. Now in SQS part 1, also some clinical scenarios are being included. However, part 1 MRCOG exam is more clinical oriented and more questions are there from obs and gynae from clinical practice. So if anyone is working already in gynae ward, it's easier to do that in this exam. So who's eligible for MRCOG1? Anyone who has a medical degree, and it's better to take after house job because you have at least practical experience. If you have done a house job in obs and gynae, it's well and good. However, if you have done house job any other specialties of medicine or surgery, you have a basic knowledge of medicine and surgery, which is going to help you. And those who have done FCPS part 1, but they're waiting for residency, it is the ideal time for them to do MRCOG part 1 instead of wasting their time. And you can do it during residency or doing non-training job. And it's best to do during first 2 years of residency, because after that you can start preparing for FCPS part 2 and MRCOG part 2 at the same time. How you have to apply? First of all, create an account on RCOG website. I'm giving you a brief outline on how to apply for the exam. When you will start applying for the exam, you can ask for guidance if you need to. Then complete an eligibility form. When you will create an account, then you will automatically be directed to complete an eligibility form. You will complete that form. Requires a primary medical degree, MBBS. You have to attach the copy of that medical degree. Then you have to show expression of interest. There are few dates in which you have to show expression of interest that I am interested to take this exam this for this attempt. Like you're interested for January attempt, January 2026 attempt. Then dates will come and booking window opens in which you have to book the exam. After a period of 4 to 6 months, so 4 to 6 weeks, this booking window closes. Some candidates think that we will apply for the exam once we are sure or when the window is going to close. But uh, keep in mind that slots are limited and the seats are sold or booked within few minutes of opening the window. So whenever if you're interested or if you're going to book the exam, you have to book the exam immediately when the booking window opens. So we'll book exam, choose a center, and we'll pay online. There are maximum 6 attempts of MRCOG1 and fees £555 for band B country. We fall in band B country. So this is a lot of fee. So apply for exam when you're fully determined. And you have to attempt MRCOG2 within 7 years of passing MRCOG1. Otherwise, your MRCOG1 exam will nullify. And it's not necessary to pass MRCOG2 exam within 7 years. It is necessary to attempt MRCOG2 within 7 years of passing MRCOG1. So the current dates of the coming exam are there are 2 sessions, January and July. July has been done. July exam has been done, and its result will be announced soon. For 2026 January exam, you can apply for eligibility till Friday 29th August. I will recommend that if you're planning to for the exam, you at least create an account, fill the eligibility form. It doesn't take any, you don't need to pay any fee for that. So at least do these things. Even if you're not going to book this exam, you should have your account and you should have your eligibility done. You will fill the eligibility form and then email will come. They will reply in an email uh, that you are eligible for the exam. Usually everyone is eligible, but if there are some mistakes in the documents or anything like that, then there are some problems with eligibility. Otherwise, everyone who has done MBBS is eligible for the exam. Then you have to show expression of interest. It will close on September 9th and booking window will open on October 21st. So you have to book the exam when booking window opens. At the same time, you have to log in on your computers and you have to book the exam. And the exam date is on January 14th, 2026 and result will be released on February 11th, 2026. This is a detailed breakdown of the subjects which are asked in paper 1 and paper 2. Paper 1 has anatomy, biochemistry, embryology, epidemiology, genetics, physiology, and paper 2 has biophysics, clinical management, data interpretation, immunology, microbiology, pathology, and pharmacology. So textbooks from where you can read, you have to choose only one textbook. It should be a basic book. And if any topic is missing from that book, then you can uh, consult any other book. So these are books. One is Tim Chard and Richard. Other one is Essential Revision Guide or Revision Notes. These two books are extensive, Revision Notes and Essential Revision Guide, and usually you don't need any other book with them. So you can choose either Essential Revision Guide or MRCOG Revision Notes. Notes are in the bullet forms. These revision notes, the big book, and is in bullets form. So it's a bit difficult to memorize it for the first time. So you can check both these books. I can give you soft copy of these books, and if you are in, and you can buy the book which you like. Then for question practices, there is Andrew Sizer, Pass MRCOG, and On Examination SPS by BMG Group. It's Pass MRCOG book has 2 volumes, and it's very good book. All the books are good. It's better if you read all the books. Maximum practice these questions. So if you do all these books, it's well and good. Otherwise, you have to do at least pass MRCOG. It's both volumes. So how you can excel in the exam? That's focused on applied clinical knowledge. In many books, after a topic, a heading of applied clinical knowledge is given. You have to focus on that. Many questions come from that. And for focusing on applied clinical knowledge, you have to have a basic knowledge of that subject. So that's the thing you need to do. It's a must. And as many MCQs as you can practice, you have to do those questions. And you have to practice as many recalls as you can. Because around 40 to 50% paper comes from recalls as well. So different courses that we're offering in these courses, there are different type of courses. I will share the details of these courses later. Usually what we do is that weekly schedule is shared at which topic you're going to read daily, and you have to do practice SBS daily from MCQ books. I will tell you the name of the book and chapter from where you have to do those questions. I will also share questions in the group, and you have to answer the questions in the group, and you will discuss these questions. I will give you feedback on these questions. You will interact with each other as well, and everyone can post their questions and post their queries in the uh, group as well. And in few courses, recordings of the summaries also provided. There's a discussion and live recording on Zoom as well. And at the end of the week, assessment of the topics that are covered in the weeks is done on an app called as Socrative. It's very easy to use that app. And after that assessment, detailed feedback on those questions are given. Uh, Questions that are added in the assessment are mostly the recalls as well as the important questions that can be asked in the exam. So it's very important to attempt that assessment and go through the feedback. So let's start our first session. I will discuss musculature of anterior abdominal wall. We know that the muscles of anterior abdominal wall, main muscles are external abdominal oblique, internal oblique, transversus abdominis, and rectus abdominis, and pyramidalis is also there as well. These are the interior abdominal wall muscles. I've chosen this topic because questions come in many forms from these muscles, musculature of abdominal wall. You can see here these are the external abdominal muscles. These are the internal oblique muscles. These are under the external oblique. The transversus abdominis, the transverse and rectus abdominis, which has intersections like this. So it's very important to understand these muscles. External oblique, as a name shows, it is on the exterior side, and it arises from lower 8 ribs, external surfaces of ribs 5 to 12. and it inserts on the outer half of the iliac crest, inguinal ligament, pubic tubercle, and crest, and aponeurosis of the interior rectus sheath. We will learn what is rectus sheath later. And internal oblique, its direction is opposite to external oblique. This is external oblique, and internal oblique fibers run in the opposite direction. These are the internal oblique muscles. It originates from the iliac crest. The external oblique inserted here. It originates from iliac crest and inguinal ligament and inserts on costal cartilage of lower foreribs and linea alba. Then is the transversus muscle. The fibers run transversely. Sorry, I have a bad throat. That's why my voice is like that. It runs transversely. It originates from costal cartilages, lower 5, 7 to 12. Thoracolumbar aponeurosis, iliac crest, and inguinal ligament. This muscle runs in this fashion and inserts on abdominal aponeurosis in the midline and the linea alba. Rectus abdominis muscle, it's also called as six pack muscles, which the bodybuilders usually show. It originates from the pubic crest and inserts at the fight process, costal cartilages of the fifth, sixth, and seventh ribs. This is small muscle, pyramidalis muscle, triangular shape. It originates from pubic crest and pubic symphysis and inserts into the linea alba. So, what is linea alba? We talked about it a lot. It's a fibrous structure. This is linea alba. It is fibrous structure that runs down the middle of the midline of the abdomen. And it separates the left and right rectus abdominis muscle. This is rectus abdominis muscle and separates the right and the left one. This is rectus abdominis muscle, the right one, this is the left one. And it extends from xiphoid process to the pubic symphysis. And it's white in color and a tendinous line formed by the fusion of rectus sheaths layers, interior layers. So what is rectus sheath? It is a strong fibrous sheath. It encloses rectus abdominal muscles, rectus abdominis muscle and pyramidalis muscle. So the muscles enclosed in it are rectus abdominis and pyramidalis. And it is formed by the aponeurosis of three flat abdominal muscles, external oblique, internal oblique, and transversus muscles. We learned here. So it is formed by aponeurosis of transversus, internal oblique, and external oblique. And the rectus abdominis muscle and the pyramidalis muscle are the contents of rectus sheath. They are enclosed in rectus sheath. And its contents, other than the muscles, are superior epigastric artery and vein, inferior epigastric artery and vein, lymphatic vessels, and nerves. Then there is an important landmark called arcuate line. What happens that this line is formed at a level when the when the layers split. There are two layers of rectus sheath. One is the interior layer and one is the posterior layer. So what happens that above this landmark, the arcuate line, interior layer is formed by aponeurosis of external oblique and the interior half of internal oblique. And the posterior layer is formed by posterior half of internal oblique and transversus abdominis aponeurosis. And below arcuate line, which is at the level of lower 1/4 of rectus sheath. So the above arcuate line is the large area, it is 3/4, and below is the 1/4. So all the aponeurosis of the muscles, they come interior to rectus muscle. And the posterior wall is only formed by transversalis fascia and peritoneum. So the posterior wall is weak below the arcuate line. So this is the arcuate line. This picture transection is showing skin. This is above the arcuate line. Above the arcuate line, this is aponeurosis of external oblique. And the internal oblique splits into the interior layer and the posterior layer and the transversalis muscle. And below the arcuate line, all the aponeurosis are anterior to the skin. In this picture, skin is shown here. So this is the interior part. If you talk about if you talk about arcuate line surface anatomy, it is the 1/3 distance between umbilicus and the pubic symphysis. It is at this level. So at this level, all the muscles, all the aponeurosis, the abdominal muscles, they come anterior to the rectus abdominis muscle and the pyramidalis muscle. They come anterior, they form the interior layer of arcuate line, rectus sheath. And its clinical importance is that it is weak. This part is weak. So it is risk for hernias here, and it is a landmark during lower abdominal surgeries as well. Again, this picture is showing the structures above the arcuate line and below arcuate line. So this was arcuate line. This is above arcuate line, the aponeurosis of external oblique muscle and the interior fibers of internal oblique muscles. They're forming the interior layer of rectus sheath. This is rectus sheath. This is rectus abdominis muscle, which is enclosed in the rectus sheath. And posterior layer is formed by the posterior fibers of internal abdominis muscle and the transversus abdominis muscle. And below the arcuate line, all the aponeurosis are coming interior to the rectus abdominis muscle. So all are forming the interior wall, and the posterior wall is only formed by transversalis fascia and the peritoneum. I hope that it is clear. Is it clear to everyone? Because the quiz is related to this topic. If anything is not clear, you can unmute your mic and ask question. So let's move on to quiz. You have to open your mobile on Google, write Slido and open Slido. It's very easy. Just go to Chrome and write Slido in the search bar. When you open Slido, it's written like as join as participant and enter code here. So you have to enter this code 2349279. It's written on the left side of my screen. 2349279. If you have joined, should you proceed? Have you joined that? The question is, a surgeon is performing. ज्वाइन कर लिया
सना
आपने?
अभी ज्वाइन नहीं हुआ।
अच्छा, कोई
नहीं, अभी
प्रॉब्लम हो
ज्वाइन
रहा है?
नहीं हुआ, तो ओपन हुआ।
कोई
हाँ,
प्रॉब्लम
थोड़ा
हो रहा
स्लो
है?
है नेट में, दोबारा करो।
देखो, वरना फिर मैं ऐसे प्रोसीड करते हैं। इफ अटेम्प्ट कर लो।
ओके।
और फातिमा, आपका ज्वाइन हो गया? डॉक्टर फातिमा, आपका ज्वाइन हो गया? चलिए हम स्टार्ट करते हैं। क्वेश्चन है, a surgeon is performing an abdominal wall dissection for a hernia repair. While identifying the posterior rectus sheath, he notices that below a specific anatomical landmark, the posterior sheath is absent, leaving only the transversalis fascia and the peritoneum covering the rectus muscle. What is this landmark called?
और फिर
आ गया? स्लाइडर पे ज्वाइन हुआ है आपसे? चलें ठीक है, आर्कुएट लाइन है ये, ठीक है।
नहीं, अभी ज्वाइन नहीं हुआ, मैं ट्राई कर रही हूँ साथ साथ।
अच्छा ठीक।
जी, मेरा ज्वाइन हो गया।
ज्वाइन हो गया?
हाँ जी।
चलें ठीक है, आंसर कर दें इसको फिर।
सना, कोड बता दें।
अच्छा, ये है कोड। मैम आपका ज्वाइन नहीं हुआ अभी भी। 2349279। हो गया ज्वाइन। 2349279 जो एंटर करते हैं। पहले ही क्वेश्चन है, दोबारा अटेम्प्ट कर लेते हैं इसको। Surgeon is performing an abdominal wall dissection for a hernia repair. While identifying the posterior rectus sheath, he notices that below a specific anatomical landmark, posterior sheath is absent, leaving only the transversalis fascia and peritoneum covering the rectus muscle. What is this landmark called? So you have to choose the answer. The answer is arcuate line, as we discussed. So this is the correct answer. So this is the arcuate line, and below it, this is the area of weakness where posterior layer is formed only by the transversalis fascia and peritoneum, and all the other aponeurosis they come anterior to rectus sheath. They form the interior layer of rectus sheath. This is a question from previous papers. So get ready for next question. Question is, during a cesarean section, dual cone incision is given on the skin. The rectus sheath is divided to reveal the rectus muscle. The combined aponeurosis of which muscle form the interior component of rectus sheath. So in this scenario, you have to focus on the site of incision. It is dual cone incision. So you have to recall your basic knowledge that where this incision is given. Then you can answer based on this question, because we know that above the arcuate line, anterior layer is different and below it is different. So the answer is external and internal oblique and transversus abdominis muscle. Why? What is dual cone incision? It is used in cesarean sections. It is made below the arcuate line. So it is at below the level of arcuate line, and it is about 3 centimeter below the line connecting the interior superior iliac spine. So if we draw a line connecting the interior superior iliac spines, it is 3 centimeters below it. So now we have to answer based on this incision line. So we have to know that dual cone incision is below the arcuate line. If it would have been above the arcuate line, then the interior layer should have been formed by external oblique and the interior fiber of internal oblique. But this interior layer is formed by, at this level, is formed by the aponeurosis of all the three muscles. That is external oblique, internal oblique, and transversalis. So below the arcuate line, interior layer is formed by external oblique, internal oblique, and transversus abdominis muscle. I hope this is clear. So let's come to the next question. During a laparoscopic hernia repair, the surgeon needs to identify the inferior epigastric vessels to avoid injury while placing ports. These vessels are seen entering the rectus sheath at a distinct anatomical landmark. At which structure do the inferior epigastric vessels enter the rectus sheath? We didn't discuss that question. I have entered it without discussing that. We'll discuss it now. Choose the answer, please. It is arcuate line. At the level of arcuate line, this line, the inferior epigastric vessels, these enter the rectus sheath. So in this question, it was asked that at which level the vessels are seen entering the rectus sheath, because in laparoscopy it can be visualized. So it is the arcuate line. Here this is the arcuate line, and these vessels are entering the rectus sheath through the arcuate line. So these are the same questions I added if anyone was unable to join its slide. So, how are these questions? All these questions are taken from previous exams. Are these questions clear to you now, Dr. Naima and Dr. Fatma?
हाँ जी।
That's good.
जी
Uh,
क्लियर है।
that's good because these questions are a bit tricky, and if you learn these with the help of pictures, these become very easy, and you don't need to uh, memorize these things. Let's briefly discuss about different courses which are offered by MRCOG Hub. One is quick revision and comprehensive course, superstar and final mocks. I will share the detail of these courses in the group. You can choose the course depending upon what do you think you need. For example, if you think that you have a good grip of the subjects, you can choose a course with quick revision in which you have to read the syllabus and attempt an assessment at the end of the week, and you will learn that at which areas you need to focus, at what areas you need to focus more, and we will daily share the questions in the group as well. And other courses are a bit extensive. These comprehensive course and superstar course is bit comprehensive, more detailed, in which summaries will be shared and recordings will be there. So you can choose depending upon your need. And final mocks are near the exams, 2 weeks before the exams, which will cover the whole syllabus. And 3 to 4 mocks are taken from the whole syllabus, which cover most of the recalls. And there's 15% discount on subscription of all courses till 15th July. And starting date of course will be 20th July. So if you have any questions, we have still 2 minutes left. You can ask, or you can ask in the group that I made on the WhatsApp. Dr. Naima, Dr. Padma. And please give feedback regarding today's session on WhatsApp group. If you have any query
अस्सलाम वालेकुम।
regarding
सेशन बहुत
MRCOG exam,
इंफॉर्मेटिव है।
क्या कहीं डॉक्टर
सेशन
नाइमा?
बहुत इंफॉर्मेटिव है।
अच्छा।
सेशन अच्छा था, बहुत अच्छा था, इंफॉर्मेटिव था। बस थोड़ा सा डेली हमें कुछ टॉपिक्स मिल जाए कि हमने आज एक चैप्टर ये करना है,
हाँ,
तो मतलब या खुद ही हम अपना सिलेबस सेट कर लें।
जैसे करना है आप कर सकते हो, खुद करने की तैयारी खुद कर लें आप। डेली टॉपिक वाइज जो अलॉट होता है वैसे कर लें। पहले जो कोर्सेज
तो वो
चलते रहे
टॉपिक
ऐसे
आप
होता है कि
अलाउड बता
पूरे वीक
दीजिए।
का स्केड्यूल शेयर होता है कि आज ये टॉपिक करना है, ठीक है। तो उस टॉपिक में से रिलेटेड क्वेश्चंस मैं खुद भी शेयर करती हूँ और कैंडिडेट्स भी शेयर करते हैं। तो और जो क्वेरी होती है वो डिस्कस करते हैं, और वीक के एंड पे उन टॉपिक्स की असेसमेंट होती है। एक थोड़ा सर पे होता है कि थोड़ी टेंशन होती है कि हमने टॉपिक करना है, टॉपिक करना है, तो वो उस अगर पता होगा टेस्ट होगा इसका तो फिर टॉपिक अच्छा तैयार हो जाता है और सारे रिकॉल्स उसमें डिस्कस हो जाते हैं। ये मैं शेयर कर देती हूँ डिटेल बाद में ग्रुप में, और आप कुछ आपने पूछना हो तो ग्रुप में भी पूछ सकते हैं, वैसे पर्सनली भी पूछ सकते हैं। ठीक है डॉक्टर नाइमा, डॉक्टर फातिमा, कुछ मैसेज करना हो आप पूछते हैं, सेशन एंड हो रहा है अभी। पर्सनली मैसेज
थैंक
कर
यू
दें या
डॉक्टर
ग्रुप में
साहब।
मैसेज कर दें, ठीक है।